Hello, welcome back to the channel once again. So today we will see medical first aid and elementary first aid exit exam questions. So let's start. So question number 1 is color vision is reduced in option A neuropathy, B toxic nutritional optic neuropathy, C toxic nutritional ocular neuropathy, D cerebellar neuropathy. And the correct option is C toxic nutritional ocular neuropathy. Number 2. Nutritional deficiencies in chronic alcoholism include the following except option A potassium, B magnesium and NBSP, C calcium, D phosphate. And the correct option is A potassium. Number 3. The effects of the amphetamine will increase dash and blood pressure and decrease appetite. Option A heart rate, B urine, C hungry. And the correct option is A heart rate. Number 4. Cancer of the GIT resulting from effects of alcohol are the following except option A pharyngeal cancer, cancer of the liver, C cancer of the stomach, D cancer of small intestine. And the correct option is D cancer of small intestine. Number 5. What is the most common abused drug by adolescents? Correct option. Option A cocaine, B marijuana, C heroin. And the correct option is option B marijuana. Question number 6. An amphetamine drug may available as dash or amphetamine sulfate in 5 mg and 10 mg tablet. Option A copper sulfate salt, B amphetamine salt, C zinc sulfate salt. And the correct option is B amphetamine salt. Number 7. What are essential to relieve craving for alcohol except option A fresh fruit juice, B candies, C fish, D sweet. Correct option is C fish. Number 8. What type of liquid is advisable to take alcoholic patient? Option A hot water, B cold water, C dilute juice with cold water, D dilute juice with warm water. And the correct option is option D dilute juice with warm water. Number 9. Acute on chronic pancreatitis is the effect of alcohol on the option A pancreas, B liver, C spleen, D kidney. And the correct option is option A pancreas. Number 10. What is the definition of an alcoholic? I think this one everyone will get correct. Option A someone who enjoys to drink alcohol, B someone uses various ways to justify himself and his need for alcohol consumption, for example to overcome an anxiety, induce sleep, to enliven social life and de-stress. Option C someone who drinks frequently. And the correct option is yes, obviously option B. Someone uses various ways to justify himself and his need for alcohol consumption, for example to overcome anxiety, induce sleep, to enliven social life and de-stress. Number 11. Pick one of the following familiar factors that plays a role in development of eating disorder. Option A parental attitudes to education, B parental obesity, C parental attitude to the media. And the correct option is B parental obesity. Number 12. Some signs of someone with bulimia is option A fears weight gain, B goes out to social events frequently, C eats high calorie meals, D is happy with their body and the way they look. And the correct option is option A fears weight gain. Number 13. In restricted type anorexia nervosa, self-starvation is not associated with which of the following? Option A concurrent purging, B socializing, C body dysmorphic issues, D eating only certain food type. And the correct option is option A concurrent purging. Number 14. Advanced communication system and technology stipulated by who where medical advice can be sought by. Option A, telemedicine. B, satellite communication. C, radio medical advice. D, compulsory onboard specialized. And the correct option is option C, radio medical advice. Number 15. Cancer of the cervix in women can be detected by regular. Option A, VAT test. B, ELISA test. C, none. D, pap smears. And the correct option is option D, pap smears. Number 16. People with anorexia have the fear of option A, losing weight. B, gaining weight. C, maintaining weight. And the correct option is option B, gaining weight. Number 17. In bulimia nervosa, the purging subtype, vomiting is the most common form of purging. What percentage of sufferers present with this type of purging? Option A, 50 to 60%, B, 80 to 90%, C, 15 to 25%, and D, 50 to 80%. And the correct option is option B, 80 to 90%. Number 18. In animal research, listen to which part of the brain have been shown to cause appetite loss, resulting in a self-starvation syndrome. Option A, lateral hypothalamus. B, cerebellum. C, amygdala. Option D, basal ganglia. And the correct option is option A, lateral hypothalamus. Number 19. How often should an adult have a tetanus diphtheria booster? Option A, 5 years. B, 2 years. C, 10 years. D, 15 years. And the correct option is option C, 10 years. Number 20. Wear seat belt while dash. Option A, swimming. B, smoking. C, driving. And D, drinking. And the correct option is option C, driving. Question number 21. Acute infection in HIV may present as option A, diarrhea. B, vomiting. C, swollen lymph gland. D, swelling of feet. And the correct option is C, swollen lymph glands. 22. HIV can only replicate itself inside. Option A, bloodstream. B, human cell. C, saliva. And the correct option is option B, the human cell. Number 23. Which type of treatment can recover the damage that HIV might have caused already? Option A, antiretroviral drug treatments. B, vaccine therapy. C, radiotherapy. And the correct option is option A, antiretroviral drug treatments. Number 24. Direct blood contact occurs through all except option A, needle sharing. B, transfusion. C, sharing of beds. D, accident in healthcare setting. And the correct option is option C, sharing of beds. Number 25. How many steps present in HIV life cycle? Option A, 2. B, 4. C, 5. D, 7. Correct option is option B, 4. Number 26. The escape of HIV from the immune response can be caused by option A, immune escape. B, isotope variation. C, epitope and NBSP variation. D, immune variation. And the correct option is option C, epitope and NBSP variation. Number 27. Mother to baby transmission occurs through all except option A, long before delivery. B, just before delivery. C, during childbirth. D, through breast milk. And the correct option is option A, long before delivery. 28. At what stage the virus can be found in blood stream? Option A, window period. B, acute HIV infections. C, latent reservoir. D, onset of disease. And the correct option is option C, latent reservoir. 29. Clinical latency in HIV infection referred to option A, the number of virus killed by the body. B, number of viral particles killed by the body. C. Increase the number of viral particle in the bloodstream. D. Decrease the number of viral particle in the bloodstream. And from this option, correct option is option C. Increase the number of viral particle in the bloodstream. And the last question is, which statement about a simple sling is true? Option A. The part of the sling against the chest goes over shoulder on the injured arm. B. The pigtail protects the neck from injury from the sling. C. The injured hand should be 4 to 6 inches higher than the elbow. D. The part of the sling furthest away from the chest passes over the shoulder on the injured arm. And the correct option is option D. The part of the sling furthest away from the chest passes over the shoulder on the injured arm. Thank you for watching my videos. Please subscribe to the channel for more videos.